and welcome to Health Affairs This Week. I'm your host, Jeff Byers. Today we are going to talk about a new ahead of print article from Health Affairs from the Congressional Budget Office on health insurance coverage projections in the U.S. through 2034. This article will be published in the July 2024 issue of Health Affairs, but you can read it online today at your leisure. With me today is Sabrina Corlette from Georgetown University. She wrote a piece in Forefront that's published right now called CBO Projections Are Not Destiny. Policies, ACA investments can change trajectory. Sabrina Corlette, welcome to the podcast.
Thank you for having me. It's a pleasure to be with you.
Yeah, thanks for joining us again. Just jumping into it, what were the top line findings for the coverage projections that struck out to you?
Yeah. Well, and first of all, I think just to take one little step back, I think it's important to just note why we care about the CBO's projections. Many of your listeners, I'm sure, are aware that the Congressional Budget Office is the independent, nonpartisan source of budget analysis for Congress. What they may not know, however, is that these coverage projections really are what the agency uses to provide a benchmark for how it's going to assess any proposed legislation and that bill's impact on both the federal budget as well as national coverage levels. So these numbers really are the benchmark for CBO's future scoring of bills, and that's why they're a really important measure. So to your question about sort of what are the big takeaways, unfortunately, it's a pretty negative outlook. So while for 2023, the CBO is estimating that we've had just 7.2% of the US population uninsured. That's an all-time low. They are expecting that our uninsured rate will rise to 9.2% in 2028 and then stabilize at about 8.9% by 2034. So a rather significant increase in the numbers of people who are uninsured in the US. And Jeff, I think later we're going to get into some of the reasons why that's going to occur, but I'll just quickly tick off the top three reasons. One is they're estimating about 13 million people are going to lose Medicaid or CHIP, including 5 million children. They're also estimating that enrollment in the Affordable Care Act marketplaces will drop by about 16 million. And then they're pointing also to a recent surge in immigration because many recent immigrants will be uninsured.
Well, fantastic. Thanks for sharing that. Why don't we just go ahead and break down those reasons? That's okay. So we have the expiration of ACA subsidies. How might that really affect the uninsured rate going forward?
So just to give people a little bit of context, back in 2021, Congress passed a bill that increased the amount of premium tax credits that are available to people who buy through the ACA marketplaces. Right now, thanks to that law, I think about 4 in 5 enrollees can get coverage in the marketplaces for $10 or less. So it really had a significant impact on the affordability of that coverage. However, those enhanced premium tax credits are slated to expire at the end of 2025. So we've seen enrollment really rise in the marketplaces thanks to these premium tax credits. The CBO is projecting that they will peak at 23 million people in 2025. But when those subsidies expire, marketplace enrollment will drop to about 16 million by 2027. So, potential loss of about 7 million people just through marketplace enrollment.
And then kind of jumping to another one of the reasons when we talk about Medicaid COVID policies, how is that going to affect insurance coverage in the future?
Yeah, this is another big reason why the CBO is projecting an increase in uninsurance in the country. And it's a phenomenon we're calling the Medicaid unwinding. People may have heard that term. But as part of its pandemic relief policies, Congress gave states some extra money to support their Medicaid programs. But conditioned on that money was that states keep people continuously enrolled in Medicaid and the Children's Health Insurance Program, or CHIP. Of course, as the COVID-19 pandemic wound down, the enhanced federal dollars for those programs has wound down, and with it, the requirement that states keep people continuously enrolled. So over the last year and continuing into the fall, states are doing these Medicaid eligibility redeterminations. CBO is projecting that this is going to mean a loss of 13 million people in Medicaid and CHIP, including 5 million children.
And then finally, when it comes to immigration and the potential increase in immigrants coming into the United States, how might that affect coverage?
So this is something the CBO is incorporating into its estimates now. This surge that we've seen in immigration that they estimate sort of began in 2022, and they're projecting that it will last until 2026. And they predict that about recent immigrants will be about 4 times as likely as the general population to be uninsured. So as we get this increase in immigration, that just is going to bulge out the numbers of people who are uninsured.
Maybe a quick aside, did they note where they might be coming from? Where the immigrants might be coming
Oh,
from?
you mean
Or
like what countries?
yeah.
No. I think for those who follow immigration policy, many, of course, are coming from the Southern Hemisphere, from Mexico, but the CBO in its report did not specify what countries they're coming from.
And then maybe one quick follow-up question is, as you were talking about that CBO started to put this information in their projections, is there any significance of why they started cataloging this, or was there anything going into the decision to include this data and information?
It's a great question. I mean, I think it makes sense because this is going to alter the makeup, particularly when we're talking about health insurance coverage. The folks who are, particularly if they're undocumented individuals, they are not eligible for most of our government coverage programs. So, Medicaid and CHIP or ACA marketplaces, if you are a non-citizen and don't fall into certain approved visa categories or immigration categories, you simply cannot get coverage at all. There are some states that are using state dollars to cover some of those folks, but I think one of the reasons that CBO felt that this population needed to be included here in this report is because if you are undocumented in the United States of America, you are not eligible for the vast majority of subsidized coverage programs.
Oh, well, thanks for that quick aside there, and for the reasons going into why the uninsured population is projected to rise. Are there any other interesting stories about coverage the data are telling us?
Yeah, absolutely. There's a number of them. One of them that really jumped out at me is Medicaid continuous coverage is a critical public policy. There's a lot of evidence now that paperwork or bureaucratic hurdles are a huge reason why many people do not get covered or many people do not stay covered. So we had these pandemic related continuous coverage requirements, and those boosted Medicaid and CHIP enrollment to 94 million people. Now that, of course, was intended to be a temporary policy, just through the public health emergency. But we've seen during the unwinding that the millions of people who are being disenrolled, almost 70% of them are being disenrolled solely for paperwork reasons, not because they're actually ineligible for Medicaid or CHIP. Now, some of those people are starting to trickle back in, but a lot of the coverage loss that the CBO is projecting is because somebody didn't dot the right I or cross the right T when they had to go through that eligibility redetermination process. And I think that's important for people to understand because one good policy we've seen out in recent years is the mandate that states provide children with 12 months of continuous eligibility in Medicaid and CHIP, as well as some Biden administration efforts to really streamline eligibility enrollment. And CBO is projecting that that is going to lead to some modest growth in coverage. So thankfully, I think policymakers do recognize that reducing the bureaucratic hoops that we make people jump through is really an important part to not only getting people into coverage in the first place, but keeping them there.
Yeah. Well, great. Well, thanks for that. So I know you wrote a piece on Forefront, and I really want to encourage listeners to actually click on that link that will be in the show notes and read it through. But I do find the title somewhat provocative. So, CBO projections are not destiny. Can you give some quick insights into your thinking behind that? I mean, I know you can't predict the future, but can you?
Yeah, right. So, the CBO, when it makes its projections, it does it based on current law and current policy. It's not going to try to predict who's going to win the election or what Congress is going to do. It has to make these projections based on current law. But we know that there are several policies and investments that Congress and the White House can make to not only keep our current high rate of coverage, which, like I said, is at an all-time high in 2023, but even reduce our uninsured rate even further. So I provide in the post a list of things that sort of a roadmap, if you will, that Congress and the president could take. These include expanding Medicaid in the remaining 10 states that haven't yet expanded Medicaid. It includes enabling and supporting affordable coverage options for non-citizens. It includes investing in and supporting marketplace outreach and consumer assistance, helping people who have been disenrolled during the Medicaid unwinding, if they are still eligible, helping them get back to where they belong. As we talked about earlier, continuing to reduce those administrative burdens that people face trying to get into coverage. And then last but not least, extending those marketplace premium tax credit enhancements to keep marketplace coverage affordable.
Yeah, well, thank you. Again, listeners, please check out that Forefront article. The link will be in the show notes. Sabrina, you mentioned the presidential election very quickly, and it did make me want to ask, and maybe it's not that big of a deal, but is there anything to watch regarding coverage as we enter and or like exit the presidential election cycle coming up?
Oh, yes.
Okay, great.
Absolutely. So I mentioned the need to extend the marketplace enhanced premium tax credits that are slated to expire at the end of 2025. That is something that I would love to see this Congress address potentially later this year. And the reason for that is even though they don't expire until the end of 2025, the health plans that participate in the marketplace, they need certainty and predictability about what the premium tax credits are going to be as they make decisions whether or not to participate in the marketplace, and also in terms of how they set their premiums. These are all decisions that these health insurance companies will have to make in early 2025. So the longer Congress waits to decide what they're going to do around the marketplace premium tax credits, the more uncertainty there is and the more instability there is in the marketplace and for the insurance companies that participate in it. So that is something I think that Congress needs to address regardless of the outcome of the election. But as we look towards the presidential election, it's it's really hard to imagine a starker contrast than between the two presidential candidates that we have. President Biden has spent the last 3.5 years working to shore up and build on the Affordable Care Act. He's really made it a centerpiece of his healthcare policy. And I think we have historical high coverage levels to show for that investment. I think if he were to win a second term, he certainly pledged to try to continue on that trajectory. On the other hand, President Trump, his first term ran on and attempted to repeal the Affordable Care Act. He has, as recently as November, said that he still wants to repeal the ACA, although he's been a little bit more equivocal about that recently. But if he is in office next year, I think we can expect to see a reduction in the investments in the marketplaces in terms of the outreach and enrollment. I think we'll see a push to roll back a number of the Affordable Care Act's consumer protections, including probably no longer defending the provisions in the law that provide $0 preventive services for people, not just in the marketplaces, but also in employer-based coverage. I think we can also see more bureaucratic hoops for people to get into Medicaid. For example, the Trump administration has strongly supported work requirements before people can get into that program. So a real divergence in terms of the policy approaches between the two presidential candidates.
Well, Sabrina, thanks for chatting about that and what you see might be some healthcare coverage issues in the next presidential election. With that, I think we're about at time. Is there anything that you want to point listeners to besides your forefront piece that you have going on?
No, I think we've covered it. Jeff, thank you so much for having me. It's just been a real pleasure to be with you again.
Yeah, thanks for joining us as always. And thanks to you, the listener, for listening to Health Affairs This Week. Please send this episode to a friend if you think they might enjoy it. Subscribe and sign up for our newsletters. Thanks and have a great day.